Hello and welcome to a new episode of Majlis podcast. My name is Wael Berro and I'm a family medicine consultant at Emirates Specialty. Today is a great pleasure to have not only my colleague but my friend and my next door clinic neighbor, Dr. Maria Awais. Dr. Maria?
Hi, Dr. Wael. Thank you for having me here today. Just to introduce myself, I'm Dr. Maria Awais. I'm internal medicine specialist, and currently I'm working in Emirates Specialty Hospital in Dubai Healthcare City. My subspecialty is endocrinology and diabetes. I have a specialty certificate in that with special interest in obesity and weight management.
Perfect. So then you're the right person to start immediately talking about our topic today, which is metabolic syndrome. I know the focus recently has been about obesity, and some people focus about weight, some people focus about central adiposity, but we like to discuss more the concept of metabolic syndrome. What is metabolic syndrome and why is it considered a serious health concern?
Thank you, Dr. Wael, for actually starting on talking about this topic because this is a really, really serious health concern now. And why? It has multiple factors. We will get back to that point once we establish what metabolic syndrome is. So metabolic syndrome basically is not one disease or one problem. It is a cluster of problems, including high blood sugar levels, high cholesterol levels, which includes HDL lower side and triglycerides on the higher side. In addition to that, high blood pressure and more waist circumference, or we call it central obesity. And why it's a so serious health concern in nowadays? One thing, because of its prevalence. It's very prevalent, especially if I talk about UAE. 1 out of 3 adults have metabolic syndrome. And because Dubai, is a mix of a lot of ethnicities, including the Emiratis and other ethnicities. So the risk also varies from nationality to nationality, to race. And some races are at more risk of that in comparison to others, especially South Asian population, Middle Eastern population, even, and to your surprise, even Filipino population is at higher risk. And it goes back to the genetics and as well as the lifestyle choices we make as a certain nation.
Okay. Thank you very much. And that's a very nice summary. And I know it's a complex topic and you managed to summarize it in 2 minutes. So thank you. So let's dwell a bit deeper into that, because what the conditions you mentioned is what we refer to sometimes as silent diseases that I'm not aware. So I might appear healthy, I might feel healthy, but do you think I might have metabolic syndrome?
This is actually a very, very good question that needs to be addressed, especially in this podcast, because social media has given us power to reach beyond face-to-face interactions. So yes, absolutely. Even first, different people will define health or being healthy in a very different way. So depends what you mean by being healthy. But if you mean that you have normal BMI, you are not visibly obese, can you have these diseases? Yes, for sure you can have, because it's not just about the BMI. That's exactly why the main focus when we come from obesity to the metabolic syndrome, it should vary from just BMI, and we should put more effort into what you say waist circumference, and more importantly waist to hip ratio, because that is a more better indicator of the metabolic syndrome. And another thing is, there is different kind of fats, but what fat which make you more prone to have metabolic syndrome, it's called the fat that you have on the inside. So having a big belly or having high BMI can be an indicator that there are more chances for you to have it. But even if you don't have a visible sign of obesity, still you can have metabolic syndrome.
So you're saying even if I hide my belly today, and I'm doing my best to do that now, you might say I might have fat inside on the liver and the other organs, and I'm still at risk.
Yes, you never know. And especially if you have family history or strong genetic history, then you are more prone to get it.
Then let's talk of complications. Let's talk of risk. So yes, okay, I might have metabolic syndrome and I've decided to ignore it because I didn't do my checkup. I've been, sorry to say, maybe a bit blunt about it. I'm a bit lazy that I didn't want to change my lifestyle. And there's always an excuse. Life is catching up. What am I at risk of? What are the complications that could arise?
This is actually a very good point. To be very honest, I don't call them the complications. These are the natural progression of the disease, natural consequences of the disease. So, for example, if your smoke detector is beeping and you don't pay attention to that, what's going to get there? Eventually, the whole building will get on fire. In the same way, these things, all these metabolic syndrome symptoms, to be very honest, symptoms are very subtle. So maybe you will just have a little fatigue, you're tired all the time, you have brain fog, or you have some people have some discoloration around the neck area, flexural areas, or skin tags, or something like that. But such things that are telling you that something is going on, that's your body whispering before it screams. In the same way, if we will not put importance, if we will not give importance to these signs, for example, high blood pressure, it can progress to cardiovascular disease, even it can lead to heart attacks or stroke. In the same way, if we will not give importance to high blood sugar levels or insulin resistance, eventually what will happen? You will have full-blown diabetes and then complications of diabetes after that. And in the same way, you can have fat in your liver, which can initially will not do any harm if controlled at that point. But eventually, if you're not paying attention to that, you're not making any changes, what will happen? It can start destroying the normal function of your liver.
Very good, and it sounds serious enough for me definitely to act on it. Now, 1 in 3 is very serious statistics, and that's 1 in 3 person walking around could have those risks without knowing about it.
Yeah.
What would you say, and I know we mentioned that they're mostly silent, but what would be the early signs that would trigger those people to say we need to seek help? What should they look for and how would they get diagnosed?
That's actually a big dilemma because as in other disease, chronic disease processes, metabolic syndrome also will show signs when it's already too late. Already we are switching from preventive to treatment already. But if you pay attention to yourself, if you pay attention to the small warning signs, you can be in a better place to make an early diagnosis, to get an early diagnosis from your physician and act on it in a right manner. As we just mentioned a few minutes ago, that it can be just overall not feeling very active, not feeling very well, having low immunity, having sometimes you did a blood test or something, then you find out that you have high blood sugar levels. Or if you notice that you are not able to lose weight as easily as other people are. So maybe it should be concerning, and especially if you have a family history of any of these diseases, that should put you in that should make you more vigilant about these things, and that should be the right time. Go and see your physician and get yourself checked.
Very good. So I got myself checked. I'm borderline risk. I have a couple of symptoms or signs that action is needed. But I'm a bit reluctant about medications. So we encourage people to do lifestyle changes. What sort of lifestyle changes I need to implement to make a difference in my wellness?
Okay. So when the patient, and to be very honest, we are seeing this so much in our clinical practice, that patients will come to you even when you do the regular checkup. We found some things are borderline, some things are high. We will find out they have strong family history. But when we talk about the treatment, a lot of patients are very reluctant because most patients have this misconception that once they started the medication, they have to take it for the longer period of life, for the rest of their lives. And that is a very scary thought. If I put myself in their place, maybe if I don't have the right knowledge, I will do the same. However, that's the good thing. When coming to the doctor and doing the lab tests or the regular checkup, it's just like GPS. It's guiding you the direction where we are going. We are going that direction anyway, if you know or don't know. But if we know where we are going, we can make the right turn at the right time. In the same way, about lifestyle, to be very honest, metabolic syndrome, I say the treatment is lifestyle, and lifestyle. Medication we will introduce when we are not making any progress, giving patient ample time, motivating the patient again and again, and most importantly, educating and reinforcing the information. What main things we can do? The main things are big three. One is the nutrition. Our food is just like a piece of information. Our body listens to whatever we put inside. So eat healthy, cut on the carbs, cut on the junk food, on the frizzy drinks. So any food that is high calorie or high sugar, we need to avoid that. This is the first thing. Second thing is exercise. Now, it's a very interesting topic that when it comes to exercise, there are a lot of things that we can do. So this excuse that I have a very busy lifestyle and I don't have time to go to gym is not valid. Many things we can do. The first thing can be aerobics, just like cycling or swimming, or even brisk walking is considered aerobic, and that's a very good exercise. The second one can be non-exercise activities, NEAT we call it, like climbing stairs instead of taking the elevators, or just walking around more. And it's very interesting news that we found out that sitting on our desk for longer period of time is new smoking. So means it increases the risk factor for cardiovascular disease almost exactly the same way the smoking does. So, and sadly today most of the jobs are that way, that we are sitting for longer period of time. So put a notification, get up after every 1 hour or 1.5 hours, take a walk around, just stretch yourself and sit back again. In that mix, if we add the weight training, that is a very, very good exercise to do because it will increase the metabolism in the muscles and it will increase our resting metabolic rate. So we are burning calories even when we are not moving. And the third thing is in the lifestyle that I emphasize my patients a lot is sleep schedule. Sleeping well is very, very important for us. It's very important for our hormonal balances, our blood pressure, and eventually each and everything that comprises metabolic syndrome. So these are the things which we can do when it comes to lifestyle. One very important thing I want to mention here is many patients become a bit frustrated that I'm doing every right thing, but I'm not losing weight. So I just want to bring across this point that even if you're not losing weight, still all these things are helping your metabolic syndrome, they are helping your levels, they are improving things for yourself. But if, for example, we check the patient again after 3 to 6 months and we find out that the levels are still the same, we are not having any improvements in the labs, we have not any change in the scale as well, at that point, don't worry. We have a lot of things to help you. We have many things we can give to reverse the insulin resistance or the prediabetes. We can give medications to treat the high blood pressures, to treat dyslipidemias, and again, after that, we have another step, if needed. In certain cases, nowadays, we are blessed to have a lot of modalities in medications that help you lose weight and eventually improve the symptoms of metabolic syndrome.
Excellent reply, and I couldn't really have said it better. Thank you, Dr. Maria. And I love the fact about kind of these 3 pillars, sleep and hydration, nutrition and exercise.
Yeah.
And I always tell my patients, our body is the best machine. There's a lot we can do just by using our body, whether it's for weight or for training.
Definitely.
Exercise.
Actually, our body was designed to move.
Yeah.
So we have to move.
Absolutely. Now, let me move to the concept of the regular checkups. And I'm glad, and I'm sure you're the same in your practice, you're seeing more and more patients who are coming telling me, I'm actually well, but I wanted to book an appointment to check other modalities. And this brings, again, the concept of silent disease. So how important are they in your practice, and how important are you going to highlight to our audience today that please do get checked up?
So as most people think that regular checkups are reactive, actually they are not. They are proactive. We are trying to stop something before it happens. Again, who should come for regular checkup? And why and when they should come for regular checkup, it's very, very important. If you have a family history of any of those diseases, or your BMI is on the higher side, you should go for that regular checkup early. And nowadays, especially with the lifestyle we are having nowadays, food choices we are making recently, it should start at 30 years of age. Doing 1 regular checkup per year is enough at that point if everything is well and good. If we find any abnormality that needs more frequent checkups, then your doctor or your physician will guide you according to that. In the checkups, the main factors that we focus on is vital signs including the blood pressure, your BMI, your waist circumference, your waist and hip ratio, and the basic lab tests including your blood sugar levels, your cholesterol levels, your liver health, and your kidney health. This small set of blood tests it takes like 10 minutes. It can give you so much information that can change the course of your life for the next 10 years.
Amazing. And again, I cannot emphasize the importance of these checkups and these numbers and data. Thank you very much, Dr. Maria. It was a real pleasure to have you over today. Any take-home message or any take-home message you want to tell our audience today?
Thanks a lot, Dr. Wael, for having me today. My take-home message for my listeners would be, if you're listening today and you feel like whatever this doctor is saying, it sounds like me, don't worry. First, you're not alone and you are not powerless. There is a lot we can do. Just listen to your body, know your numbers, take an action now, and you will be safe.
Thank you very much. Prevention is better than cure, but early detection is as important. Thank you very much for listening. This brings us to the end of today's episode. Stay tuned for another episode of Al Majlis podcast by Emirates Hospital Group. Thank you again, Dr.
Thanks
Maria.
a lot. So kind of you.